Welcome back and congratulations. You are officially in the final 12 weeks of your pregnancy. The third trimester of pregnancy is a very exciting time. However, it can also bring some discomfort and anxiety. As you're navigating through the final trimester, there are several signs and symptoms to keep an eye on as you reach your baby's birthday. Luckily, your healthcare provider will more than likely ask to see you for more frequent checkups. In fact, most obstetricians suggest appointments every 2 weeks, beginning at the 32-week mark, and then weekly at 36 weeks. These appointments may seem overwhelming, but your NutriVantage Mom's dietitian is here to help. This module will address the following topics and questions: what to expect as your body is changing through these next few months, how do my calorie needs change during this trimester, a nutrition focus on magnesium, omega-3s, and choline, what are Braxton Hicks contractions, testing that may be done for a healthy and safe pregnancy, and the importance of taking care of your mental well-being. Next, we'll cover what to expect as your body is changing throughout the next few months. As baby continues to grow, you will notice your body changing and growing as well. Obviously, you're growing more in the front, meaning that your balance and movement may be altered. In addition to the changing equilibrium, pregnancy hormones can relax the connective tissue that holds your bones in place. While estrogen and progesterone are helping your baby grow, the hormone relaxin is helping to relax the smooth muscles in the pelvis, like your cervix and uterus, which helps to promote the growth of the placenta. This is especially noticeable in the pelvic area for those reasons and may cause pregnancy-related pelvic girdle pain. You may experience the pain worsening when you're walking, going up or down stairs, turning over in bed, or anytime you move your legs apart, such as getting in and out of the car. Relaxin can also cause hip pain, which about 20% of pregnant women experience. Exercises and stretches such as yoga that strengthen the pelvic area can be helpful to alleviate both of these symptoms. Be sure to ask your obstetrician for safe exercises and stretches that you can practice. Other strategies to help combat this pain include sitting upright on a couch or chair that provides good back support, wearing shoes with proper arch support and cushion. Proper posture can also provide your lungs with more room to expand as you notice you're becoming more winded easily, another effect of your expanding belly. As your baby moves deeper into the pelvis, you may experience more pressure on your bladder. This can cause more frequent urination and also may cause urine to leak, especially upon coughing, sneezing, laughing, jumping, bending, or lifting. If you are experiencing this leakage, you may want to consider wearing panty liners for added protection. Due to the increase of blood flow, you may also experience spider veins, varicose veins, and hemorrhoids. Spider veins are tiny red or purple veins that can appear on your face, neck, and arms due to increased blood flow during pregnancy. Fortunately, these usually fade after delivery. Varicose veins are swollen veins that appear on your legs. To ease the swelling, elevate legs frequently and exercise regularly. As we discussed in the first trimester module, hemorrhoids are varicose veins that appear in your rectal area and can be painful and itchy. For relief, you may try soaking in a warm tub or apply witch hazel pads to the area. Be sure to ask your obstetrician for other safe remedies to alleviate any of these symptoms. And lastly, if you have not yet experienced heartburn during your pregnancy, you may experience it during this last trimester. Heartburn during the third trimester is due to pregnancy hormones relaxing the valve between your stomach and esophagus, allowing stomach acid to reflux up into your esophagus. In addition to those hormones, as your baby is growing, there's more pressure on your stomach, which can cause acid to be pushed upwards. Here are some helpful strategies to help ease the heartburn. First, you can try consuming smaller, more frequent meals. For example, 4 to 6 smaller meals per day instead of 3 larger ones. These meals will put less pressure on your stomach, decreasing the amount of acid being pushed back upwards. Consider drinking water in between meals instead of with your meals to help decrease the contents in your stomach needing to be digested. Secondly, you can limit fried food, high-fat food, citrus foods, and very spicy foods. These foods can increase the amount of acid our stomach produces, so limiting these foods is a good strategy to decrease your risk of heartburn. Third, you can avoid foods that can cause gas, such as high fiber foods. While fiber should not be avoided completely because it does have incredible health benefits, limiting the amount of high fiber foods consumed at each meal can help with any gastric distress after meals. And finally, be sure to sit upright for at least an hour after a meal, allowing gravity to work in your favor. If you're considering taking any over-the-counter medications for heartburn, such as antacids, there are some guidelines to follow. Always be sure to look at the label when choosing an antacid. Avoid antacids that contain aspirin, sodium bicarbonate, or magnesium trisilicate. Generally, antacids that contain calcium carbonate, such as Tums, have been found to be safe. Your obstetrician should provide you with a list of approved over-the-counter medications you can take during pregnancy. If not, be sure to ask which antacid would be safe for you. Next, we'll review how calorie needs change during this trimester. Because your baby is growing quickly during this time, your energy needs will also increase. This means that calories are necessary to keep you and your baby healthy during this time. As you have been slowly increasing your calories from the first trimester to the second by approximately 300 extra calories per day, during the third trimester you need an additional 450 calories per day. If getting those additional calories seems overwhelming to you, similar to the strategy for heartburn, try consuming 4 to 6 smaller meals per day. Keep in mind, overall weight gain and weight gain per week is dependent upon your weight prior to conception. For instance, if your pre-pregnancy BMI was 25 to 29.9, you should aim to gain approximately 0.6 pounds per week during this trimester. Be sure to work with your NutriVantage Mom's dietitian to develop an eating plan that fits your needs. For ideas on how to healthfully increase your calories to meet the need for the extra 450 calories per day, refer to the handout Healthy Snacks to Increase Calories, found in this module. Now let's move on to a nutrition focus on magnesium, omega-3s, and choline. Let's begin with magnesium. Along with calcium, magnesium is an important mineral for bone health. It also helps your body utilize protein, regulates both blood sugar and blood pressure levels, and assists with muscle and nerve function. Be sure to get enough magnesium during pregnancy, as it has been shown to reduce the incidence of preeclampsia. Preeclampsia is a condition that occurs when there is a sudden rise in blood pressure and swelling. This most often occurs in the face, hands, and feet. Preeclampsia is the most common complication that can occur during pregnancy. It generally develops during the third trimester and can affect 1 in 20 pregnancies. Your doctor will monitor your blood pressure and watch for protein in your urine, or proteinuria, at each visit, as these are the most common signs of preeclampsia. If the preeclampsia goes untreated, it can develop to eclampsia, in which case the mother can experience convulsions, coma, and even death. Magnesium can also reduce the incidence of intrauterine growth restriction. Intrauterine growth restriction is a condition in which an unborn baby is not growing at a normal rate inside the mother's womb and therefore is smaller than it should be. Magnesium can also be beneficial for women suffering from leg cramps. Be sure to include a variety of magnesium-rich foods in your diet, such as nuts, seeds, legumes, whole grain breads and cereals, dark leafy green vegetables, and dark chocolate. The recommended intake for pregnant women is between 350 to 400 milligrams per day, depending on your age. Your prenatal vitamins should include magnesium. If you find your prenatal vitamin and daily intake is not adequate, speak to your obstetrician regarding supplementation. For more extensive lists on magnesium-rich foods, refer to the magnesium food list found in this module. Now let's move on to omega-3s. Omega-3 fatty acids are very important during pregnancy. They're also important for breastfeeding, which will be discussed in future baby care modules. It is believed that omega-3s are involved in the development of your baby's brain, central nervous system, eyes, and may be important for the timing of gestation and birth weight. There are 3 main types of omega-3 fatty acids, which include ALA, EPA, and DHA. ALA is found mostly in plant oils. DHA and EPA are found in fish and other seafood. In one study, results showed that higher DHA cord blood concentration was related to longer gestation, better visual acuity, and mental and psychomotor skills at 6 months and 11 months of age. Omega-3 requirements during pregnancy have not been established, except for ALA. Because ALA is considered an essential fatty acid, meaning that your body cannot make it, the National Institute of Health recommends pregnant women take in at least 1.4 grams of ALA daily and should consume more omega-3 fatty acids than they would when they are not pregnant. For pregnant women to obtain adequate omega-3 fatty acids, the following sources should be consumed: 2 portions of oily fish per week, such as salmon, mackerel, trout, or sardines for DHA and EPA, and consume daily servings of nuts and seeds, such as flax seeds and chia seeds, for ALA. Supplementation of omega-3s during pregnancy may also be beneficial, especially if your dietary intake is low. One study compared the use of supplemental DHA to a placebo in pregnant women from 16 weeks gestation until delivery. DHA in the red blood cells of the supplemented women was 32% higher compared to the placebo at week 36. Outcomes of the study showed that infants were 3 times more likely to have low visual acuity scores in the placebo group compared to the DHA group. Again, since there is not an established recommendation for DHA and EPA in pregnant women, check your prenatal supplement to see whether or not these omega-3s are contained in those supplements. Now let's review the nutrient choline. The importance of ensuring adequate choline intake during pregnancy is being increasingly recognized. Choline plays a critical role in the development of your baby's cell membranes, nerve impulses, and brain development. Many prenatals and multivitamins lack choline, and for this reason, you should aim to include foods rich in choline in your diet. Choline-rich foods include eggs, salmon, kidney beans, low-fat milk, pork, chicken, turkey, beef liver, and wheat germ. Choline is found in both animal and plant sources. However, animal source foods typically contain more choline per gram than plant sources. Beef, pork, chicken, and fish are concentrated sources of choline. Eggs and cow's milk are also good sources. Plant-based foods containing choline includes nuts, beans, legumes, and cruciferous vegetables such as broccoli. It's always important to be sure you're adding nutrient-dense foods such as these to your diet. If you have any questions or concerns as to whether or not you're getting adequate nutrients during pregnancy, please be sure to speak with your doctor or your NutriVantage Mom's dietitian. What are Braxton Hicks contractions? As you approach your delivery date, you will most likely hear about Braxton Hicks contractions. They're mild, irregular contractions in your abdomen. These contractions tend to occur more often and become stronger as you approach your due date. They're more likely to occur in the afternoon or evening. Some of the common triggers for Braxton Hicks contractions are physical activity, you or someone else touching your belly, after sex, when your bladder is full, and from dehydration. To alleviate Braxton Hicks contractions, try changing positions. If you've been sitting or lying down, try getting up and moving around, and if you are already up, take a seat or lie down. Taking a warm bath or shower can also help. Be sure not to become overheated. Because the contractions can be brought on by dehydration, be sure you're getting plenty of fluids. As stated earlier in the Pregnancy Trimester 1 module, when you're pregnant, you need more water than when you're not pregnant. At least 8 to 12 8-ounce glasses, or 64 to 96 ounces per day. Be sure to watch for signs of dehydration during your pregnancy. Having adequate water in your system will help you to regulate your body temperature. Maternal overheating can occur if you're not drinking enough water. Another sign of dehydration is darker colored urine. If you're well hydrated, your urine is light yellow or clear. If your urine is dark yellow, it means you need to be drinking more water. Next, we'll talk about what types of testing may be done for a healthy and safe pregnancy during the 3rd trimester. Prior to delivery, your healthcare provider will most likely recommend a Group B strep screening test. Group B strep is a type of bacteria that can live in your vagina or rectum. Approximately 1 in 4 pregnant women carry Group B bacteria in their body. It may cause an infection for your baby if he or she is exposed to this bacteria during birth. If there is evidence that you are positive for Group B strep, meaning it is present in your vaginal canal, your doctor will most likely recommend antibiotics during labor to decrease the risk of your baby developing Group B strep. Because Group B bacteria grows back quickly, taking antibiotics prior to delivery is not recommended. And finally, let's review the importance of taking care of your mental well-being as you get ready for this incredible life change. As you prepare for baby to come, it is essential that you're staying mindful of not only your physical health, but your mental health and well-being. There's so much to think about and plan for in these last few months. While on one hand you're feeling very excited and ready to meet this new love of your life, you also have a million thoughts running through your mind. Whether it's worrying about labor and delivery, or whether or not your pregnancy is going as planned, or you may be stressing over what will happen once baby arrives, experiencing anxiety during the 3rd trimester is very normal. It's very common for women to worry about the pain associated with birth. Taking a childbirth preparation class, talking to your doctor about pain management alternatives, and discussing delivery with other mothers may help to alleviate some of this anxiety. The more you know, the better and more prepared you'll feel. Maybe you have concerns about what's normal and what's not as you're approaching the end of your pregnancy. Not knowing whether the various aches, pains, changes, and strange sensations that your body is going through are normal can cause concern as well. Understanding what's happening to your body during the 3rd trimester can put your worries in perspective. If you have concerns, always call your doctor. Nesting. Nesting is in high gear during the 3rd trimester. This is the act of preparing your home for baby's arrival. It is typically fueled by big bursts of energy late in pregnancy. Birds and many other animals feel this biological urge as well. Like them, you may feel the urge to get your nest ready for your newborn. Nesting typically involves making physical preparations for parenthood, such as cleaning, decorating the nursery, setting up baby gear, and doing loads of laundry. Doing all of these physical acts can actually help you mentally prepare and bond with your baby before arrival. It puts you in parent mode and gets you thinking of the changes and new routine that will come about when baby arrives. Below are a few things to check off your list as you prep for baby to arrive. Enjoy your baby shower. There's nothing better than being surrounded by all of the special women in your life, many who are also moms and who have been through almost everything you're going through right now. Stock up on baby essentials you may still need after the shower. Consider making a few healthy meals ahead of time so you don't need to do as much cooking after baby arrives. You can make large meals and freeze them in individual containers to reheat at a later time. Refer to the handout Easy Batch Cooking Meals for plenty of nourishing recipes to try. It may also help to plan ahead for help from friends and family with things like cooking and cleaning, or even putting together a meal train. A meal train is an organized schedule in which loved ones sign up to bring you or send you meals for a few days a week for up to a month or so while you and your family are adjusting to having your little one at home. There are many websites that can help you with this. Just search Meal Train Setup. You may also be thinking about whether you will breastfeed or formula feed your baby. This might be the perfect time to consider reviewing the 0 to 3 month module regarding breast or formula feeding, or to begin discussing these options with your NutriVantage Mom's dietitian. Pack your hospital bag. Things like a change of clothes for you and baby, diapers, toiletries, snacks, and cell phone chargers should all get packed in the hospital bag. It's also great to take a few comfort items from home when you go to the hospital, such as your favorite pillow, a cozy blanket, or your favorite playlist. If you're planning to breastfeed, you may also consider packing a breastfeeding pillow, a breastfeeding cover, a nipple shield, and a breast pump if you feel you'd like some guidance on how to use these items. Also, don't forget to have your significant other pack a change of clothes too if they'll be staying overnight. Most delivery wards and hospitals have tours for expecting moms. Reach out to your hospital to schedule a tour prior to your delivery date. This tour can help familiarize your plan when your due date arrives and allow you the opportunity to ask any questions to make you feel more comfortable. Pre-register with the hospital. This will make checking in at the hospital much easier because all of the paperwork will already be taken care of. Make plans for your other children and pets. Be sure to know ahead of time who will take care of your other children and pets while you're in the hospital. Install a baby seat in your car. It will make life much easier when you put baby in the car for the first ride home. Think about names for your baby if you haven't already. Finally, enjoy these final moments of your pregnancy and try to imagine the joy and love that will be surrounding your new little one as they enter the world. This is an amazing time for you and your family. You'll do great, Mom.